This presentation is focusing on remote areas and their need for mental health care. To start, you may be wondering what I mean by remote areas. Basically, what that means is a community or place that is distant from highly populated places or lacks transportation. The purpose of this presentation is to support the need of care for this vulnerable population, show how this population experiences lack of justice and care, ways that I can address QSIN's competencies when providing care for the remote areas. I will also share ways to take on the role of the nurse advocate for this population and discuss the importance and impact of access to care, empathy, and justice in delivery of care. The reason I chose this population is because it caught my eye during my research for this project, as well as it is also a type of population that we don't hear a lot about or pay attention to when it comes to vulnerable populations. Also, something to keep in mind is that a lot of my research was interviews and literature focusing on remote communities in Darwin, which is the capital of Australia's Northern Territory. However, the struggles that they face in the remote areas in Darwin can be very similar to other remote areas in the world. According to a series of films by Mental Health Education, there are many limitations and difficulties when it comes to providing quality treatment in remote areas. For example, access to client bases for remote nurses in the Northern Territories could be 300 to 400 miles away from where the remote nurses are based. This causes the nurse to have to provide care through a fly-in, fly-out service, so nurses may only get to a particular community every 2 or 3 weeks. Also, during wet season, that period is extended to possibly even months depending on how bad the weather is. When healthcare providers are unable to fly to communities, their only other option is to provide care is to have phone consultations with their clients. This causes inconsistency of treatment and decreases the quality of treatment as well. In addition, evidence shows that incidence of psychosis in remote areas is just as consistent as with the rest of the world. However, they are getting totally different care than what would be given in an urban community. There are little follow-up with the clients during the average 3 weeks that they are gone without seeing their clinician, and oftentimes remote nurses notice that mental illnesses take a step backwards when they are not getting the consistent treatment that they need. The nursing theory that provides direction for improving care for remote areas is Patricia Benner's clinical wisdom and nursing practice theory. The 6 aspects that Benner created for clinical judgment and skilled behavior are as follows. First, practical reasoning in an ongoing clinical situation. Second, knowing what to do, when to do it, and how to do it. Third, adapting interventions to meet the changing needs and expectations of patients. Fourth, knowing one's sense of and ability to act on or influence a situation. Fifth, the ability to tune into a situation and hone in on the issue by engaging with the problem and the person. And sixth, know the understanding that good clinical practice cannot be separated from ethical notions of good outcomes for patients and families. Deborah Sarasa stated that the work of the nurse is essential to closing the gaps that continue to burden the Australian health system. These gaps must be addressed and aim for sufficient health care for all, regardless of nationality, wealth, or location. Remote areas experience inequity in care because even though they have the same amount of psychosis and other health concerns as the rest of the world, they are not getting the same treatment that the rest of the world is. Another injustice thing that many people in remote area care have to face is that confidentiality is not always possible. For example, in the Northern Territory, sometimes the only interpreter available is the client's family member. Not only is this making it so that the patient has to tell their family member everything, but this also negatively impacts the nurse as well because they have to keep in mind that the information that they are getting from the assessment may not be totally accurate. This is because the client may be hiding things solely because they do not want the family member that is interpreting to hear, or because the interpreter may be saying things differently than the patient actually is saying. Another disadvantage that remote area care has compared to urban area care is when it comes to treatment options. It becomes very hard in remote areas for healthcare providers to actually be able to treat everyone in their home communities compared to urban areas where it is more straightforward. In remote areas, there are no after-hour clinics, no active follow-ups. In reality, often the result in remote communities is that people will need to be flown to a major center, and it is an extremely large expense. In addition, it is also difficult to get people back to their home communities once they are out of inpatient care because they have to normally wait for a flight to be available or room on the flight to be available. So many people have to wait quite some time to even be able to go home compared to people in an urban area that would be able to just take a taxi or a train back home. This only takes even more of a toll on the client that may be still recovering and could cause them to take a step back in their improvements. Another disadvantage that remote areas face is that also in some areas, the clients do not have the proper knowledge to know the evidence of how being consistent with their medication treatment is crucial and how it can improve their health. Also, with injection medications, healthcare providers cannot always guarantee that they will get a lab result back in time before it is time for their client's next injection. So this may also affect their options on medication treatment. This almost makes it impossible to choose the best medication regimen for a client because it's a struggle to determine medication compliance and availability. One of QSIN's patient-centered care competencies I can address is demonstrating comprehensive understanding of the concepts of pain and suffering, including physiologic models of pain and comfort in the mental health patient. I can do this by making sure to do a full and accurate assessment of pain levels and comfort levels. And as a remote area nurse, I would make sure if my patient seemed to be suffering that I would let other members of the care team know as soon as possible. That way there is a better chance of accurate follow-ups and that everyone will be working to do the most that they can for this patient. Another patient-centered care competency I can address is elicit patient values, preferences, and express needs as part of clinical interview, implementation of care plan, and evaluation of care. I can address this by making sure that I am aware of their beliefs and values and to follow their beliefs and values at all times and make sure to inform other care members of their values as well. For example, if a man only wants a male health care provider, I would respect that and inform other team members as well. The last patient-centered care competency that will address is to seek learning opportunities with patients who represent all aspects of human diversity. Being a remote area nurse gives someone a great opportunity to travel, learn, and experience so many different beliefs, religions, and values. That can really show the beauty of all different cultures in the world. On the other hand, one of QSIN's teamwork and collaboration competencies that I can address is identifying system barriers and facilitators of effective team functioning. In order to have a functional and effective healthcare team in remote areas, the nurse has to be able to identify when something is not working effectively while also paying attention to and discussing the things that are helping and providing quality care for the patients in the best available way. The second teamwork and collaboration competency that I can address is acting with integrity, consistency, and respect for differing views. I can do this by listening to what the other members of the healthcare team have to say, and I will not respond in a way that makes it seem like I am shutting down their beliefs or ideas. I will remain non-judgmental and open to their opinions. The last teamwork and collaboration competency I will address is respecting the centrality of the patient or family as core members of any healthcare team. In some cultures, and often in remote areas, families can be extremely close, and it is the patient's wishes for the family members to be fully involved. But before providing care to a patient, I will make sure that I know what they prefer when it comes to family involvement, and I will respect their choice. According to Sarasa, as a remote area nurse, some of the ways I would be able to provide empathetic, equitable care is by ensuring that people are prepared for the extremes of winter, have immunizations, are given medicine when needed, receive care for injuries, are treated for drug and alcohol abuse, and have access to mental health treatment. It is important as nurses that we practice our role to the fullest so that we can provide the best treatment available. In addition, it is crucial that we also recognize the importance of getting rid of these inequalities in our healthcare system. It is unfair that people are not getting the same treatment as others just because of their location and even wealth. Reflecting on CUSIN's competencies to provide equal care to clients in remote areas, remember to provide comfort to the patient and make sure that they feel safe and are not in pain just as nurses in an urban area would do. Also, patients' customs and beliefs should always be respected. Even when there is low staff and limited resources, remote area nurses still need to respect patient wishes. By doing these things and spreading awareness globally, there is a possibility of closing the service gap between remote area healthcare treatment with the rest of the population.